This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, July 7th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Adjunctive Psychosocial Interventions and Opioid Abstinence Among Patients Receiving Buprenorphine, a Randomized Clinical Trial. This randomized clinical trial of 340 adults with OUD taking buprenorphine examined the comparative effectiveness of two psychosocial treatments, cognitive behavioral therapy, or CBT, and peer recovery support, or PRS, on opioid abstinence when used as adjunctive therapy to office-based buprenorphine treatment in adults with OUD. Researchers found that neither PRS, CBT, nor a combination of these psychosocial interventions yielded differential effects on opioid abstinence. These results suggest that adjunctive psychosocial interventions may not enhance buprenorphine treatment outcomes in the early stages of treatment. Next is an article in Drug and Alcohol Review and is titled Concurrent Use of Extramedical Medication for Opioid Use Disorder Among Adults Prescribed Methadone or Buprenorphine, a cohort study of urban adults who have injected drugs. Researchers sought to assess the use of extramedical medications for opioid use disorder, or EMMOUD, among those receiving prescribed or dispensed buprenorphine or methadone. For persons reporting receipt of MOUD in the last 6 months, researchers assessed dose, length in treatment, and report of EMMOUD. Overall, researchers found 18% person-level prevalence of EMMOUD use, with those who reported use of multiple substances, injection drug use, withdrawal sickness, past 6-month incarceration, or homelessness more likely to use EMMOUD. Among those who received methadone, dose was not associated with EMMOUD use, but those in treatment for more than 6 months had lower reported use. Duration of treatment for buprenorphine was not associated with difference in EMMOUD use, but those prescribed higher doses were more likely to report EMMOUD use. Of note, researchers could not assess prescribed MOUD and EMMOUD use, and if it was concurrent. Our next article is in Addiction and is titled Collaborative Care Intervention for Risky Opioid Use Among Primary Care Patients, the STOP Randomized Clinical Trial. Millions of Americans engage in non-medical opioid use without meeting criteria for moderate or severe OUD. These individuals may benefit from interventions that reduce risky opioid use and prevent progression to OUD. Researchers conducted a cluster randomized clinical trial utilizing a collaborative care intervention consisting of brief advice from the primary care provider, interactions with the nurse care manager, and remote health coaching. The researchers did not find a statistically significant difference in mean days of risky opioid use between groups. However, participants in the intervention group had lower rates of moderate to severe OUD at both 6 months and 12 months. In addition, high-risk prescription opioid use declined in both groups, but was significantly lower in the intervention group at 12 months. Our next article is in JAMA Health Forum and is titled Geographic Availability and Use of Medications for Opioid Use Disorder Among Medicaid Enrollees. This cross-sectional analysis of approximately 8 million Medicaid enrollees in 10 states explored if racial and ethnic differences in the use of medications for opioid use disorder among Medicaid enrollees are associated with geographic availability. Increased geographic availability of methadone and naltrexone was associated with increased use among non-Hispanic white enrollees, but not non-Hispanic black or Hispanic enrollees. Availability of buprenorphine was not associated with differential use. Increasing geographic availability of medications for opioid use disorder is likely a necessary but not sufficient strategy for addressing variation in access to care. Next is an article in JAMA Network Open titled Development and Implementation of an AI System for Generating Clinical Urine Drug Test Sign-Outs. This prognostic study involving 83,000 urine drug tests at a single medical center assessed if an AI-based system could be used to enable more rapid interpretation and clinical sign-out of urine toxicology tests. AI prediction of substance use patterns was highly accurate across 26 substances. Following integration into the clinical workflow, AI-based preliminary test interpretations reduced clinical sign-out times by 28.5 seconds on average, while retaining high accuracy. These findings suggest that AI-based preliminary interpretation of urine drug testing results is fast and accurate and may provide substantial efficiency gains to the clinical service. Next is an article in Clinics in Dermatology and is titled Tannorexia, the Psychodermatology of Compulsive Tanning. This paper describes the phenomenon of compulsive tanning and its similarities to SUDs. Individuals continue UV exposure despite knowing of the risk of skin cancer and photoaging. Compulsive tanning has also been linked to distorted body image and appearance preoccupation and behaviors such as mirror checking. The first use of sunbeds before age 35 is associated with a 75% increased melanoma risk. UV damage to skin DNA promotes pro-opiomelanocortin or POMC transcription. POMC is processed into melanocyte-stimulating hormone and B-endorphin, potentially producing opioid effects. Naltrexone results in reduced UV exposure, and withdrawal symptoms of dysphoria, anxiety, and irritability have all been reported. There are several screening tools, including modified DSM criteria and CAGE questions. The authors suggest cognitive behavioral therapy and sunless tanning products as a harm reduction strategy. Next is an article in Hippocampus titled Opioid-Associated Hippocampal Injury, Past, Present, and Future Directions. This paper reviews the evidence for injury to the hippocampus associated with opioid use and OUD. Opioid-associated amnesic syndrome, or OAS, is indicated by amnesia, mostly anterograde and mild retrograde, hippocampal abnormalities on scans, and opioid use, particularly fentanyl overdose. There is increased metabolism and possibly seizure activity in the hippocampus. The amnesia can persist for weeks or months with subsequent hippocampal volume loss. OAS is rare, but many cases may go undiagnosed. The Chanter syndrome following opioid overdose involves edema of the cerebellum, hippocampus, and basal ganglia, likely from toxic or ischemic injury, and can result in compression injury. There is increasing evidence linking OUD with reduced hippocampal volume and increased risk of dementia. The authors are concerned that the full scope of these effects may not be seen for years to come. Next is an article in the International Journal of Drug Policy and is titled Public Perspectives on Supervised Consumption Sites Across Canada, a Cross-Sectional Study. This survey-based study used data from the Canadian National Questionnaire on Overdose Monitoring, a national online cross-sectional survey, to assess public perception of safe consumption sites, or SCS. Participants responded to the survey between July 2022 and May 2023. Overall, SCS were positively reviewed, supporting the belief that SCS reduce overdose risk, decrease risk of infection, and improve access to healthcare and other services. Participants felt that SCS decreased public drug use and led to fewer discarded needles while also improving safety for healthcare providers. Our final article is also in the International Journal of Drug Policy and is titled Just Take It Away from Them and Talk to Them About It, Exploring Youth Perspectives on and Experiences with Cannabis-Related School Discipline. In this community-engaged qualitative study, the authors completed semi-structured interviews with 18 youth aged 14 to 20 in Massachusetts to understand their experiences with cannabis-related school-based discipline. 4 key themes were identified. 1. There is extensive surveillance of student cannabis use. 2. Disciplinary responses vary across settings and student demographic groups. 3. Students feel that cannabis-related discipline is harmful and disproportionately severe. And 4. Students advocate for harm reduction and transparency in the handling of cannabis offenses within schools. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.